You have a 45-year-old man who is working in industrial painting, accidentally injects high-pressure paint into his hand. He presents to the emergency room 1 hour later with moderate pain and swelling of the hand. On exam, the fingers are swollen, the hand is tense, and passive movement worsens the pain. You realize that I'm talking about passive movement, stretch, right? What's the most appropriate next step? A, oral antibiotics and outpatient follow-up. B, intravenous steroids to reduce swelling. C, emergency surgical consultation for possible fasciotomy. D, CT scan of the hand to assess foreign body. And E, X-ray to rule out bony involvement. Correct answer is emergency surgical consultation for possible fasciotomy. Realize that high pressure injection injuries are often missed and they are a cause of compartment syndrome. That's why I was saying that don't think that the cause of compartment syndrome is only fractures, right? These injuries require urgent decompression, even if the skin looks deceptively minor, okay? If the skin looks deceptively minor, the answer is C, not B. The answer is C. So let's do a deep dive into the risk factors for compartment syndrome as well. Deep dive into the risk factors for compartment syndrome. Why will pressure build up in the muscle compartment? There are various causes of pressure building in the muscle compartment. Why will pressure build in it? So what are some of the things which can fill that space? There can be bleeding into that space. There can also be swelling of that space. Number 2, there can be blocking of the blood flow. So for example, there can be an external thing which is blocking blood flow, like if you put a cast on and it is very tight. There can also be ischemia, and then there can also be burning of the tissues. So, if there's an external burn which forms a circumferential burn, that can also do that. So when you're thinking about compartment syndrome, don't only think about it in the context of trauma, all right?